Hi, I'm Dr. Melvin Fussell, board certified urologist and the founder of UroHeart for Men, where only size and function matters. We make you bigger, longer, harder. What we're going to talk about today is problems that guys run into with erectile dysfunction. And what I see on a clinical level is that guys come in with the big 1-2 punch. And you say, well, doc, what is that? Diabetes, hypertension. All right? That's when they are out of control. Let's talk about diabetes. What happens with diabetes, and I'm going to really simplify this, all right, is that basically you're eating too many sweets and your body can't process it. So you got all this sugar floating in your bloodstream and it basically turns your blood into syrup. Now, syrup doesn't flow the same way that blood would flow or water would flow. It's going to be thick and slow. So now your red blood cells are in that thick syrup. And when your blood flows, it goes from the arteries to the arterioles all the way down to the smallest vessels, which are the capillaries. Now, that syrup type blood flow cannot get into the small capillary vessels. So your parts of your body that have small vessels in them are where you actually start to have problems first. That's why diabetics lose a toe, then a foot, then a leg, because they can't get blood flow down into those small vessels that have small parts of the body that have capillaries in them. Now, contrary to thinking, the penis has small vessels in it. So what happens a lot of times, guys come in to see me and they can't get erections. And the reason they can't get erections is because they can't get blood flow into that tissue because their blood sugars are too high. I always ask the question, what was your last hemoglobin A1C? If you have a diabetic that doesn't know what hemoglobin A1C is, that person has a death wish because they're not paying attention. I mean, you didn't ask for diabetes. You didn't want that in your life, but you got to play the game to live. So you need to know how to play the game. You need to understand what hemoglobin A1C is. You need to know that, hey, that number should be less than 6 when it's completely controlled. So the thing is if you don't know what I'm talking about, hemoglobin A1C, then pick up your cell phone and ask your cell phone, what is hemoglobin A1C? Or just ask it, what is A1C? And it will start teaching you. You're walking around with the library in your pocket. So the thing is learn about A1C because it's most important. And if you're diabetic, you got to know. And if you come in to see a urologist or another doctor and your A1C is like 10, 11, 13, oh, you don't have a chance of maintaining erections. Now, the second part of the 1-2 punch is hypertension. Now, the thing about it is that one organ in the body likes high pressure, and that's the penis. So when you get that high pressure, doom, 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 it is actually destroying other parts of the body, like the liver, the kidneys, the eyes. They can't take all that high pressure. And what do we do as doctors? We put you on medication to get the pressure down so you don't destroy the other organs in the body. But the penis is unhappy because it wants as much pressure as possible. So now, yes, I'm helping you, but your erections fall off because you're taking a medication that actually decreases that blood flow and that blood pressure. And now you start noticing that I'm having more erectile dysfunction. But if you could imagine, I got poor flow because my diabetes is uncontrolled. And I'm also on blood pressure medication. All right. I got the 1-2 punch. Diabetes, hypertension. Your erections are going to go away. They're going to end. It's going to be over unless you make a lifestyle change. So you got to control your diabetes. Your blood pressure, it's got to be controlled, but there are medications that your doctor can put you on to cut down on erectile dysfunction. So those are things that you need to know about. I want you to follow us because we got other topics that we're going to discuss that guys are always asking me about. So I'm like, okay, let's discuss it. Like what is premature ejaculation and all this other kind of stuff. You need to understand. And in addition to that, I need you to go to our website, yourheart.com, and we need you to follow us so you can learn more about male enhancement, and erectile dysfunction. You're hard for men.